We ready? All right, here we go. So, elevator speech. You do not need PPE for this. Gather and cleanse equipment. For this, there is no equipment. We're not going to be using any equipment for this. Place the client in a comfortable position. Are you comfortable? Yep. All right. We're going to ask 3 interview questions related to skin conditions. What are 3 questions we can ask?
Any family history or personal history of skin cancers?
All right.
Yes.
All right.
Do you have any
Anybody else?
skin conditions like eczema, anything like that?
No.
All right. One more.
Any abnormal like moles or anything?
Good question.
History of abnormal
Good
moles
question.
or
Any abnormal moles?
No.
Welcome. All right. So we're going to inspect the skin for color. So as much as you can. You do not need to take off clothes, but as much of the skin as you can. So just looking here, looking at her arms. I'm just going to look at your back. That's okay. Just going to go up. And then legs. Let's look and see.
Oh, geez.
What are we looking for? What kind of colors would be abnormal?
Purple, blue.
I know. What are terms we're going to use instead of purple or blue? Jaundice. Okay. We're going to inspect the skin for lesions, bruising, or rashes throughout the body. You can combine these as you're going through and say, I'm looking for skin color, looking for bruises, lesions, rashes. So going through, I'm fine if you combine those 2 parts together. All right. So throughout the entire body, so we're going to be looking at as much skin as we can. And then we are going to verbalize the ABCDE mnemonic for evaluating skin lesion. What was A?
Asymmetry.
B?
Border.
C?
Color.
D?
diameter,
And E.
evolving.
She got it. So you're going to verbalize all of the words that go with ABCDE mnemonic. Any questions about that? All right. Then we're going to inspect the nails for shape, contour, and color on the hands and feet. Oh, you do have to take your shoes and socks off.
That's what happens when you volunteer tonight.
So shape, what could we use as a descriptive word?
For the nail bed?
Yeah, flat, right? Something abnormal would be more of a clubbing, that would be more rounded. Normal texture, are they dry nails? And color, pink. Some people, if they have really cold toes or fingers, it might be a little of a cyanotic, a little bluish tint to the fingers. So color, contour, shape, they are flat, pink, and nice and normal. All right. And then we're going to palpate hair for texture. So what are some descriptive words? So what would you find with hair?
Dry.
Oily.
Thin.
Greasy. So hers is nice and normal, not oily.
Sure.
Not greasy. Then we're going to palpate the skin, temperature, turgor, and texture. So temperature, my hands are cold, I apologize. Yeah. Cold hands, warm heart. Nice and warm skin. All right. Turgor. Check for her skin turgor. Non-tenting. Where would we check the skin turgor on an elderly patient? Sternum. And skin is normal. It's not dry, it's not moist. So nice normal skin texture. Then we're going to move on to the musculoskeletal, and we're going to ask 3 questions regarding the musculoskeletal. Yes, you put your shoes and socks back on. So what are 3 questions we can ask regarding musculoskeletal?
Broken any bones?
Have you broken any bones?
Nope.
All right.
Do you work out?
Do you work out?
Not very often.
All right.
If they have any like the fake joints or anything like that.
Any
Had
replacements of
replacements?
joints?
Yes.
Yeah?
Jaw.
Oh, interesting. All right. And I've told you guys before, if you're struggling with questions to ask for these, if you look in your OER, they have a lot of questions that you can ask to get some examples. All right, we're going to inspect anterior posture. So after she gets her shoes on, we're going to have her stand up and check the anterior posture. What are things we would look for in the anterior posture? That's back. You want to make sure your shoulders are nice and straight, you're standing up nice and straight, you're not slumped over. So I'm just inspecting the anterior posture. That looks nice and straight. And then we're going to inspect the posterior posture. I'm looking for any signs of lordosis, kyphosis, or scoliosis. What do you guys see with kyphosis? What part of the body has an accentuated outward curve? All right, what about lordosis? Lumbar, and it's an inward curvature, right? All right, we're gonna inspect balance by doing heel to toe walking. So I'm gonna have you do heel to toe, 5 steps forward. All right, then we're gonna go 5 steps back. All right, then we're going to do Romberg. So Romberg, I'm going to have you explain it. We're gonna do the Romberg test. I'm gonna have my patient stand straight with her arms at her side, eyes open for 30 seconds. After 30 seconds, I will have her close her eyes, and then if she sways or becomes off balance, that's a positive Romberg sign. All right, that is what I need you guys to say.
Can you say it again?
I need my patient to stand with their arms at their side, eyes open. I'll have her do that for 30 seconds. And then after 30 seconds, I will have her close her eyes. And if she sways off to the side or becomes off balance, that's a positive Romberg.
Okay. And when we do
Is that like
the,
positive for vertigo? Or what would it be? Positive for just
Your balance.
imbalance?
Yeah,
Okay.
imbalance.
when we do the actual assessment test out, do you want us to time the 30 seconds or
No.
just verbalize?
Verbalize it.
Okay.
Yep, just verbalize it. Then we're going to inspect coordination by running the heel of one foot up and down the skin. So your shin, go up and down your shin. And then we're gonna do the other one. All right. And then we're going to do coordination by doing the finger to nose. So I'm gonna have you shut your eyes and put your arms out to the side. And take your pointer finger after you shut your eyes and touch it to your nose. All right,
Both
do your
of them?
other one. All right. Missed one first time.
Got 'em.
That's okay. All right, so that is assessing the coordination and balance for the musculoskeletal. Next, we're gonna move on to inspecting the muscles. Remember, muscles. There's 2 different things we're checking. First is going to be all muscles. Then we're gonna go through and do the joints. So with the first, we're gonna do muscles, and you're going to verbalize the muscle strength grade scale. 5 is normal, 4 has slight weakness, 3 is weakness, 2 poor range of motion, 1 severe weakness, and 0 is paralysis. I need you to verbalize that scale. I have it written down on your rubric for you. All right, before we start testing. You do not need to tell us what the scores are as long as they're all good until the very end. So now we're gonna do muscles. Remember I told you guys, we need to watch where I put my hands for this, okay? For placement of hands. We're going to inspect and palpate. So we're going to inspect, we're gonna watch them do the movement, and then we're going to palpate for the strength. So the first one is the sternocleidomastoid. You guys will Google these words outside of class, and you will practice saying these words, okay? I need some attempt. I need you to practice saying the words correctly. If you are not making any attempt at saying them correctly, you will not get credit for it. So I'm going to have you move your head side to side. All right, and that was inspection. Now we're going to palpate, so go against my hand.
Wait,
Move
what?
your head.
I was like,
Turn your head. Stay still here though. Turn your head against my hand. There you go. There you go. So that was palpate. Next one is going to be the left and right trapezius. I need you to take your shoulders and shrug them for me. All right, inspection. Shrug again. Palpation. Next, we're going to move into the deltoid. I'm gonna have you do a field goal. And have you go up and down. All right, inspection. So palpate. I'm gonna put my hands right here by her biceps. Not on her shoulders because we're doing muscles. Right on our biceps. Go up and down. All right. So inspect and palpate for that. Then we're doing hand grips. Just need to inspect, so I'm gonna have you take both hands and squeeze. All right? I'm gonna put my hands in, squeeze them again. All right? And then we're moving into biceps and triceps. These are opposing muscles. So I'm going to have you take your arms up, go down, come back up. All right, so I'm going to hold on to our arms here, go down, and now wait. Go on our forearms and go up. Do you see where my hands are? I'm gonna go this way, down. That's testing your tricep, testing your bicep. So you're gonna knock both of those out of the park when you do that. Tricep, bicep. Then we're going to do hip abduction and hip adduction. So I'm going to have you face me. I'm gonna have you take each leg. We're gonna go out and in, and out and in. Which one of those are abduction? And adduction is what? You're adding to the body, so you're going in. So I inspected, now we're gonna palpate. I'm just gonna take my hand and put it on the outside of her lower leg here. So I'm gonna have you go out, all right? And then I'm gonna have you go in. Gotta have some balance. It's a hard one, okay? And in. It is, I would probably fall over. If you don't have good balance, let your person know. We'll have you hold on to a table or something, because I do not want people falling. So abduction is what? Out, and then adduction is in. And we're doing on the outside of the leg and the inside of the leg. Then we're going to do the quadriceps and hamstrings. Quadriceps, hamstrings. So I'm gonna have you sit down for me. And I'm going to have you just kick your legs out and back in. All right, that's our inspection. Now I'm going to have your legs go out. That's testing your quads. We're going in. We're testing the hamstrings. Did you guys get that back there? Do you want her to turn around? Okay. All right, so I'm gonna have you swing your legs out and back in for inspection. And then we're going to just go on the shin. That's for your quads. That's for your hamstrings.
So for palpation for muscles, you're just providing resistance.
Yep.
That's all you're doing. You're not feeling the muscle or feeling the joint. You're providing resistance for that patient to push against.
Yeah, because you're testing the strength. So yep, you need the resistance to go with it. All right, so now is the time you're going to verbalize the muscle mass, or the muscle size, symmetry, and strength. So strength is going to be a 5 out of 5. Hers were all normal. Her muscles were symmetrical. And the size was normal. Think about size. What are some abnormal sizes? You might have people like elderly that have their muscle mass has decreased quite a bit. They have smaller muscles. Weight builders, bodybuilders who have the big muscles. So those are examples of different muscle sizes. Symmetry, if somebody's had a cast on an extremity for a while and the muscle on that one leg or that one arm has decreased due to lack of use versus normal muscles on the other arm. So symmetry, and hers were all equal. All right, we're going to inspect active range of motion in the joints. So we're going away from the muscles and now we're going to do the joints. We're going to inspect and palpate the temporomandibular joint. And if you see on here, I don't know which is the best way for you guys to. Can I get a chair? Yeah. Chair. Kelly, she wants to see everybody.
Just move the table. Thanks, Austin.
All right. So we're going to check the temporomandibular joint. And I have written in here all the steps you need to do. So we're going to do extension and flexion, and I'm telling you what those are. So I'm going to have you open your jaw, and I'll have you close it. And now we're checking for the movement of the joint. So I'm going to feel both. My hands are so cold. Open and close. Ooh,
I know, I'm so
look at you. All right, so we inspected and palpated. Now we're moving on to the cervical spine. So cervical spine, we're testing up here. We're going to do flexion, extension, lateral, and then rotation. So flexion, chin to chest, extend back. You're gonna put an ear to each side. and then you're just gonna rotate your head. All right, now I'm going to palpate, so I'm gonna put my hands on the back of her neck to feel those joints. I'm gonna have you put your chin down, put your head back, ear to each shoulder, and then rotate your head around. And we're feeling for smooth movement of those joints. Next, we're going to do the shoulders. All right, we're gonna stand up.
Oh, I was like, I'm gonna move.
I'm
or are
going
you
with
good over
you.
there?
I'm
Okay.
going with you. So we're going to flex, extend, abduct, adduct, internal rotation, external rotation. Okay, so now I'm going to palpate and I'm going to feel her shoulder joints as she does this. Oh, thank you. I can go up. There you go. Now you can stand up. Okay, arms to front, back.
Wait, this way?
No, nope.
What did I do? Oh, this way. I forgot what I did.
We're going back, abduct,
Yeah.
abduct. Okay, we
Okay.
got this now?
Sure.
All right, we're going. All right. Extend, and then you're gonna go away from your body. Abduction, adduction, internal rotation. So internal rotation, and then external rotation.
Gorgeous. My brain's fried today, guys. Sorry.
Okay, internal rotation and external rotation.
There's nothing
All
left in
right.
here.
You're good, you're good.
Never volunteering.
No, I'm so tired. Got nothing left in here.
All right, so we're going to go on to the elbows. And elbows are going to be extend, flex. We're gonna go out, we're gonna do pronation, supination. All right, so now we're going to feel her elbows. Flex, flex, extend, pronation, and supination. All right, so feeling that elbow joint. I usually make everyone stand up and do this at the same time, but nobody would see me, I think. All right, wrist. We're going to do flexion, extension, rotation. All right, feeling them. Flexion, extension. Oh, I'm sorry, that's flexion. Yep, flexion, extension, rotation. You are crackly.
Sorry.
Getting some exercise. All right, fingers. We're going to straighten the fingers. So have them straight. Abduction, adduction. That's it for the fingers. So for this, you're just going to place your hands on top of the fingers. And you're going to abduct, adduct. I'm going to have you make a fist and then straighten them out. Okay. All right, so that one's an easy one. Abduction, adduction, and then just straightening the fingers out. All right, so then we're going to move into the knees. So we're going to flex the knees and extend the knees. So this is the same thing as you did for your quadriceps and hamstrings. So you're gonna sit there and you're going to bring both legs out and bring them back in. Okay, out and in. Good. Moving on to the hips. We're doing extension. We're gonna stand up. All right, flexion, extension, abduction, abduction, and then rotate. All right, then we're gonna do the other leg. We're gonna do flex, extend, abduct, adduct, rotate. So we're going to palpate now. So she's gonna do the same dance, and we're going to feel that hip joint. You're not gonna kick me. I'll move. It's my fault if you do. So hip joint, I'm gonna have you flex, extend, abduct, adduct, and rotate. Same over here. Flex, extend, abduct, adduct, rotate. Good. All right, we're moving on to the ankles, so I'll let you sit back down. We're going to do dorsiflexion. So you're going to bring your feet up. You're going to do plantar flexion, and then inversion and eversion. So inversion, yep, and then eversion if you can point them out. And we're going to feel the ankle joint. So dorsiflexion, plantar flexion, inversion, eversion. Good. And then we're going to go to the spine. So stand on up. We're going to do flexion, extension, side side to side. I don't. We're gonna rotate and then side to side. All right. So I'm just going to feel her low back to see how she does. We're going to flex, extend, side to side, rotate. All right. You can have a seat.
Michelle, could you show just the position on her back where you had her?
Oh yeah, if you want to stand. I was feeling her low back here. Thank you.
Thanks.
All right, and that is the end. Thank you for the exercise class. Is there anything I can do for you?
Nope.
Here. I'm going to do my 5 safety measures. Going to cleanse my equipment, clean up supplies, which there is none here. Perform hand hygiene, report any deviations from the norm. I'm going to do my documentation. Start item. 1 note, start item. Okay? That means you will be unsuccessful if you do not turn in your documentation.
When is it due?
It is due at 10 o'clock tonight. 10 p.m., same time it's been all semester, 10 p.m. Okay? Documentation, 1 note. Everybody got this? All right. And that is it. Any questions?